Hi YouTube, what's up? My name is Ellie and welcome to the channel. If this is your first time here, I'm a non-binary trans guy and I'm recording my journey with gender. I've been on testosterone for 3 years and 11 months, coming on 4 years next month. And I'm also having top surgery really soon. I also have like news about top surgery, but that's going to be a little bit of a surprise for whoever sticks around. Okay, I always say that I'm going to talk about something and then I forget it. So I might as well just talk about it now. Okay, so I decided to change surgeons. So I was going to go with Dr. Tintore. And after being interviewed by Dr. Mosquetelo in Barcelona, I decided I'm going with him, Dr. Mosquetero, because I think he has consistently good results. And I think he gets nipple placement right. Now, he doesn't always do the scarring the way I like some of his scarring look very cupped. But I've spoken to him and I've asked, and he says that it really depends on the shape of breast that you have. And I find that it really does build a lot of confidence when a surgeon tells you just the stuff the way it is, because other surgeons have told me that they can do whatever they want, and all of a sudden somebody says, look, it really depends on your structure, and I go like, either it depends on your structure or the surgeon can do whatever he wants. Like, one of these guys is wrong, right? Or maybe they do different techniques and then they're both right. But my gut feeling is that if you give it to me honest in a way that like doesn't make you seem all powerful, then it is more likely to be the truth. So I'm going to go with Dr. Mosquetero because I really feel that I can trust him, that he has consistent results, that he gets nipple placement right, which is really important to me. And that's it. I'm going to get the operation on the 22nd of July, which is like a week later than I was going to get it with Dr. Tintore. And I can afford it because the top surgery GoFundMe is on fucking track. You people are awesome. Thank you. And now let's go over to the streaming part of this video. So I want to reintroduce Niki. Niki has been here last week, or was it 2 weeks ago, or was it a month ago?
God. 2 weeks ago.
2 weeks ago. And we started talking about top surgery, just two trans guys kicking ideas around. And we actually didn't get to talk about bottom surgery at all. And I think that's pretty interesting, Niki, because you had bottom surgery. You wanna run us through it?
Sure. So one of the reasons why I actually chose my surgeon in particular, again, that was Dr. Schwarz in Northeast Germany. And I can only agree with you, go with your gut feeling. If you talk to someone during a consultation and you think, I'm in good hands here. And that's what happened to me. And something that really attracted me to their clinic in particular is all the trans experience that they had. And my doctor said to me, we can either do just top surgery or we can do a hysterectomy at the same time or at a later date. And if you want a hysterectomy, I ended up doing that. You can also get an ovarectomy, so the removal of the ovaries. And
actually, Niki, I think it would be cool if you could tell people a little bit about what is a hysterectomy, because I'm not sure everybody's on point with the terms.
Sure thing. So I took some notes here for this. Okay, a hysterectomy is when you remove the uterus. Mm-hmm. This means you are not going to menstruate any longer, but your hormone production, so mostly your estrogen production, is going to remain the same. So it doesn't affect your hormones in any way. At the same time or at a different date, you can get an ovarectomy. So that's the removal of the ovaries. You again would not menstruate any longer. But at that point, you'll have to be on hormone replacement therapy for the rest of your life, either with estrogen or testosterone. It doesn't matter. You can pick that. But if you have your ovaries removed, your body doesn't produce enough hormones any longer.
Because the actual hormone producing tissue is in your ovaries. I'm not sure if everybody is like down on the terminology, but like the ovaries in a female body and the testicles in a male body, theoretically speaking, if it's a completely formed reproductive system, then the production of hormones is basically just in the ovaries. So you can have your uterus removed and you would still have the same level of like blood, estrogen, and the rest of it.
Yeah.
But if you remove the ovaries, then game over. Your body is not going to produce the same level of hormones.
And the consequence of that, it's not that you're going to die or anything. It's just you will immediately be in menopause. So you will be having all those experiences that old ladies tend to tell you about, you know? And that's not very good for a young person. Yeah. And so what I had was a total hysterectomy. That means I've had the uterus removed, the cervix, which is the opening to the uterus, right? And I've had a salpingectomy with the ovarectomy, which means they also remove the fallopian tubes. So that's the connection pieces to the ovaries. Mm-hmm. Because in my opinion, it makes no sense to leave something that I don't intend to use. It can only, at worst, develop cancer, maybe cysts, something along those lines. And personally, I know medical trauma is a topic for a lot of people in the trans community. I wasn't willing to go through that for the rest of my life. So for me, it wasn't only to rid myself of menstruation. I also took the step because I knew I wanted to be on testosterone for the rest of my life. If I'm really wrong and I want to go on estrogen for whatever reason, it's really unlikely, but that's okay too, because we have ways to make this happen, is what I'm saying. So a total hysterectomy, meaning all the feminine reproductive organs have been removed. And this was actually what they did first. So I go under anesthesia and then they do that. And after that, they did the top surgery because that took longer. So I was in surgery for about 2 hours. And there are different ways to perform a hysterectomy. Mm-hmm. What I had is called an abdominal incision. So just like with my top surgery, I had a cut made. And I can show you that in a moment. And that's called a laparotomy, when you make one cut in the abdomen. So some people say, people say that that's really ancient technology. I disagree with it because infections are not really a concern any longer in this day and age. And it's just, look, when the surgeon cuts you open like that, he can see everything that's inside. So if you have any issues, cysts, cancer, endometriosis, bladder dysfunction, whatever, they see that immediately and they're able to fix it. And I knew that I had issues in that region, and my surgeon was able, to fix that.
So I just want to take a second and maybe talk about like the different approaches that you mentioned here and why a surgeon might choose to use one or the other. Like you mentioned, when you actually make an abdominal incision, it allows the surgeon to see what's going on. And there's a few more implications to that. For example, these surgeries, they tend to leave a larger scar. If you're cutting through the abdominal wall, you're also cutting through muscle and connective tissue. So recovery is going to be a little bit different. You're going to have to consider the fact that you've basically damaged all this tissue and they need to repair. And some of these surgeries can be done through the vagina, o sea is Spanish, I'm sorry. What I mean is that gynecological surgeries can sometimes just be performed through the vaginal opening, which means that the surgeon can't really see what's going on. And it sounds like in your case, I don't really remember your medical history and I don't want to like talk about things that you haven't mentioned, but when there is, when there's a suspicion of tissue that's infected by cancer or something like that, then an exploratory surgery is a lot better than a surgery where the surgeon is kind of limited. So depending on like what is the situation with your reproductive system, that the surgeon might decide to do this or that. And you have to know going into it that you might not be able to decide for yourself if you're going to have an abdominal scar or not. And it's really like it depends on like how good the imaging that you can get for that. Like, can you get an ultrasound? Can you get an MRI? Is it clearly visible? Does the surgeon know exactly what they're going to expect? Or are they also doing this because of non-dysphoria motives, which could be related to like cancer and stuff, you know? So
exactly. And what you mentioned, the vagina removal, personally, I would have never done that for a plethora of reasons. First of all, it's absolutely necessary. My surgeon is a gynecologist and oncologist, so he really deals with these issues every day, not just in a trans related context. Yeah. If you decide for that method, you absolutely need to have a complete gynecological examination before then, because if the organs are too large to remove vaginally, they end up having to do a cut anyway.
Yeah.
And they want to avoid that. So if that's an option for you, you have to know what the preparation for that is going to be like.
Yeah.
I would have decided against it because I believe all the issues you hear about with hysterectomies, like your bladder prolapsing or a vagina prolapse, really extreme things, or incontinence, I believe those things do not happen because you have the uterus or the cervix removed. I believe they happen, my surgeon confirmed this, either because you've gone through childbirth before and your tissue is stressed because of that, or because during the surgery they damage those tissues. And if we consider that they're pulling an organ out of what is essentially a muscle, a sleeve, in my opinion, you're going to damage something there. So I personally wasn't comfortable with that. There's also a medium between this, if you don't want a cut and you don't want them to pull this out. And that's if you have
laparoscopy.
A laparoscopy, exactly. So that's keyhole surgery. And they will perform very, very small incisions, maybe near your belly button, maybe a little bit below that. And what they will do is with those very small instruments, they are going to cut the organs from the connective tissues, but then they're going to pull them out vaginally. But they've been loosened, is what I'm saying. So you're probably not damaging anything there.
So for anyone who's not on point with all the anatomy that has to go with the female reproductive system, what it looks like basically is that the pelvic floor is a bed of muscles through which there is, I think, I don't know if the urethra has its own opening, but it has the openings to allow both the digestive tract to finish and the reproductive system. And of course, the urinary system. So what happens is that from these muscles, there is like a bed of ligaments that arises that kind of holds together all these organs. So you have the last chamber of the digestive tract, which I think is called the ampulla, which is where the poop waits to be released. And you have the vagina itself. And then you have the uterus and the bladder. And what happens is that the bladder kind of sits on top of the uterus when you're standing upright. And usually the explanation that is given to prolapse is that because the uterus is not as muscular as it is initially due to atrophy, and atrophy is when muscle goes away. And this happens usually with menopause. So with menopause, you stop producing the hormones, which keep the uterus kind of muscular and keeps its volume. So it becomes kind of like a little smaller or just not as strong, we can say. And then the weight of the bladder theoretically pushes everything down through this opening in the pelvic floor that we've talked about. Now, this is technically called prolapse. And what happens in gynecological surgeries is that one of the complications of removing the uterus is an early prolapse or falling through of the bladder. Now, this is not a subject that I'm very expert on. This is something we really just glossed over in physical therapy studies in university. But do take into account that most of the literature on this is on menopause-aged women, not transgender men. So whatever it is you're planning on having, your system is quite different than that of a menopause-aged female, unless you are at the age of menopause, in which case, yes, this stuff is quite applicable to you. Some people transition very late in life.
Yeah, this is exactly what I asked my surgeon about. He said, don't worry. It's happening every now and then. It's a complication, but it's not the norm. And I'll show you my incision real quick. You can see what that looks like. So can you see that in the sliding?
It looks like there is a small horizontal line at the base of your stomach, basically.
That's what it is.
Yeah.
So if you have keyhole, they'll be putting small holes here instead. That's all there is to it. So they cut it in the abdomen, they removed it from the abdomen. And for me personally, they found my ovaries completely covered in cysts, in fibroids. I had endometriosis all over them. That explains my extremely painful periods. And yeah, it's a good thing I had everything removed, you know. And my surgeon explained it to me, if you remove both the uterus and the cervix, you essentially have a hole in the abdomen. And that's why they sew from the inside. This has nothing to do with your vaginal opening. From the inside, they will sew what he calls the vaginal cuff, and then everything's closed up again. And they do this regardless of whether you had an abdominal incision or keyhole, or whether they yanked it out vaginally. If both the uterus and the cervix come out, then they sew it shut, but it doesn't affect your feeling, your look, or anything. It's internal is what I'm saying.
So like the vagina basically is kind of like a sleeve. And just to keep things clear, like if this is the pelvic floor and the vagina goes into the body, then I think you're talking about sewing shut the part that is actually internal, not the external part. When
the external part, if you get that shut, that's called vaginectomy or colpectomy. That's not the same thing, guys. It has nothing to do with a hysterectomy.
It's different. Like a hysterectomy is completely internal. You can't see it from the outside. I think you can maintain complete function of your vagina if you have a hysterectomy. Is that correct?
I don't know this from personal experience, but my surgeon says many of the trans guys he's operating on are sexually active in that manner, and none of them have issues. And another concern is really because some of the lubrication in the vagina comes from the cervix. It's cervical fluid. It's not all just from the vaginal glands, but he says his patients are happy. That's all I can tell you.
So endometriosis, just for anyone who's not familiar with the technical term, is a kind of cancerous tumor, right?
They don't classify it as such yet, but there's a movement towards it that we start taking it more seriously. We initially thought that endometriosis is when the lining of the uterus grows outside of it, so in your stomach, on your bladder, ovaries.
Okay.
Today, most doctors will tell you, and this is still in baby steps with science, most doctors will tell you that it's not exactly that either. So like I said, my surgeon works in oncology. He deals with these things a lot. And I asked him, what is that? And how does it develop? Does it come back? He said, we don't know for sure, but he believes estrogen actually causes it, that it's just a malfunction, that it's not a cancer in itself, it's just a malfunction. And as long as a trans man, a non-binary person, a woman, whatever, who has had this tissue removed, does not take estrogen again in the form of hormone replacement therapy, and as long as this person had the ovaries removed, he believes endometriosis does not come back, but he can't say for sure.
So I actually know this a little bit from the obesity and PCOS side of stuff. So so obesity is when you have excess adipose tissue or fat tissue in normal words, and when you have that tissue, it's really important to know that fat or adipose tissue is part of what secretes estrogen in the body. So there are different kinds of estrogen hormones, and estrogen is not the only sex hormone that a female reproductive system has.
But it has minute amounts of testosterone, just not enough to keep you going naturally.
So adipose tissue, the kind of estrogen that it secretes, is actually a kind of estrogen that's in large amounts not beneficial to the body. And one of the things that seem to be a result of having a lot of estrogen secreting adipose tissue is a likely recurrence of endometriosis and PCOS. And endometriosis, like you said, is about uterus tissue growth when it's not in the uterus itself. So PCOS, or polycystic ovarian syndrome. Now, cystic is a cyst that has cysts. So for anybody who doesn't know, a cyst is like a little pocket of tissue that grows in the body where it's not supposed to appear. So,
and I had one on my ovary that's called a chocolate cyst. They call it that because it's dark brown, because it's filled with blood. That can burst anytime. Sucks.
Beautiful. Absolutely gorgeous. So PCOS,
we should give this a content warning, man.
We should content warning this thing from like the title.
From beginning to end.
Yeah, like content warning, medical chit chat. Okay, so.
Dick and pussy, yeah.
Thank you for demonetizing my content. No, my content is not monetized by any, like, nobody pays for this. So the thing about like, I think I've heard a lot of people talk about like, if you're on testosterone, then you might get ovarian cancer. And I think where that comes from, like, I'm not sure, but I think where that comes from is that in PCOS, polycystic ovarian syndrome, the main problem that people experience is that they have an excess of androgen, which is male hormone-free testosterone in the bloodstream. Yeah. Now, the thing to understand about that is that taking external testosterone, that is injecting or applying cream or whatever, is not the same as having an excess of free testosterone in your bloodstream. I know it sounds the same. If you have more testosterone, then you have more testosterone, but it's not the same. Okay,
if that were true, all the women would be transitioning, so to speak, and it's not happening.
Exactly. If everybody with PCOS, their problem was that they had too much testosterone, and you could get to that condition by taking testosterone the way we take it as transgender individuals, then what would happen is that every woman with PCOS would transition, and it's not the case. Some women have PCOS, and I'm saying women because I mean individuals who identify as women. This is important, not just female individuals, but people who actually identify as women. With PCOS, do not necessarily exhibit signs of high-level testosterone the way that people who transition do, because there is a big difference. Now, I'm clear on that, but I'm not clear on whether or not taking hormones in order to androgenize, that is, masculinize, elevates your chances of getting ovarian cancer or getting endometriosis. This is something I would love to know, the hard research truth about this.
It's one of the first things we spoke about, because I was pre-surgery. I just made my appointment. I said, hey, do you know about this? And you were like, nah, not really. I mean, I asked every doctor about this, and some of them will tell you as if it were a fact, yeah, if you take testosterone, you have to have a total hysterectomy, or else you're going to get cancer, or at least cysts. Again, my surgeon, an oncologist, says there's no evidence for it. None. He says he personally does not believe that taking testosterone causes these issues. With so little research, it's always a matter of opinion, right? My personal take on this is the following. I believe we have a false positive here. we see non-binary people, we see trans men go on TRT, and then sooner or later we find out they have PCOS, or they have endometriosis, or they have cancer. And we think, yeah, that must be because they took testosterone and it's not natural to their system. No, your body doesn't care whether it's running on estrogen or testosterone. As long as you have one of them, you're going to be fine. I believe if we consider how many women there are who have these issues and they seek gynecological care again and again and again, and they're told, no, honey, that's normal. Have you tried a heating pad? Don't be so dramatic. You know, if we consider how many women have problems with this for the majority of their lives, and they do not have testosterone levels that are high because of PCOS, they don't have testosterone levels because they're on TRT, it's just how it develops for them naturally, then I think it's very phony to claim that testosterone is making a trans person sick or is killing them.
So that's really interesting. I actually do have the numbers for you because I'm currently writing like a seminar paper on PCOS. So the distribution of PCOS in like reproductive age female-bodied individuals is between 3 and 18% in most of the studies, which is quite a large part of the population. I mean,
and that's only what's diagnosed.
Yeah, that's
I never was diagnosed before they cut me open.
Yeah, and like my personal experience with people who suffer, individuals who suffer with PCOS, is that they usually tell me a story that goes along these lines. It's like, I've had terrible periods my entire life with periods pains, and I've had some issues with my reproductive system, and I've been told over and over again that it is nothing. I've been put on pills like the birth control pills, right? And female hormones, and that was terrible. And finally, when I got to the hospital because of a catastrophe, I was diagnosed with PCOS, and I was recommended surgery. And this is something that I've heard. It's a personal anecdote. It's like, it's not research, but I've heard this from several individuals. And it does seem to be the case that there is a kind of like attitude among health professionals to not take gynecological suffering very seriously from reproductive age women. It's kind of like the way I think society treats PMS, you know, or like cramps and period pains. It's kind of like, it's not that big a deal. Come on, it's fine. You're fine, you know?
And PCOS is really just one facet of that. Endometriosis, like I said, there are doctors who say we should be taking this as seriously as we're taking cancer.
Okay, so one story about PCOS, and I'm going to be done with this. Like, I don't want to scare anybody, but look, so I used to have this roommate who's, she's a wonderful person. We were really good friends. And one weekend, she crawls into my bed at 7 a.m. You know, this is not weird because we were really good friends, like I said. But she wakes me up at 7 a.m. on technically a Sunday. And she's very pale and very sweaty, and her heart is beating like crazy. And I tell her, like, yo, what's up? Are you okay? And she says, I think I have alcohol poisoning. I brought a guy home and we were together, and all of a sudden I felt like a sharp pain. And ever since then, I feel like I need to go to the bathroom, but I go to the bathroom and nothing comes out. So being a dumb little fucktard, I told her, why don't you come and rest a little bit, you know, and just, we'll see how you feel in a couple of hours. And I cannot stress how stupid that response was on my side, because when she woke up a couple of hours later and she was still feeling quite the same, we went to the hospital. What they ended up discovering is that she had a cyst explode, kind of like pop. Yeah. I don't really know the mechanics, inside of her pelvis, and she was bleeding into her pelvis about 1.5 liters of blood. Now, the body has about 5 liters of blood. She's not a very large individual, and she could have bled out, you know?
Yeah. And could have happened to me anytime, like I said, blood-filled cyst.
Yeah. And she did not, she knew she had polycystic ovarian syndrome, but nobody notified her that a cyst exploding is something that can happen to her, that can have adverse effects on her health. She was not notified that this could be a health crisis. Now, I don't know if this is something that happens very often, but it's quite dangerous, you know? And the amazing thing is that when we went to the gynecologist to get her like derived to the emergency room, because if you show up to the emergency room without a good reason, they charge you, you know? So the best thing to do is to get there with like a little note from the doctor that says you actually have to go to the emergency room. So I went with her to a gynecologist, and the gynecologist kind of looked at her as if it was her fault for having intimate relations with somebody, like it was like you were too rough on or something, and now you have pain, and that's like your fault somehow. And just think about it. I mean, it's a life-threatening situation, and somebody's like, oh, you shouldn't have had sex with that guy. It's like, what the fuck, you know? Like, it's like you were in a car accident, and the doctor treating you is like, why were you wearing the colors you were wearing, or why were you crossing the road? Like, what the fuck are you even talking about? Anyway,
you know, I'm gonna say this for the viewers real quick because it comes to mind. I have an autoimmune disorder, and when I couldn't really go ahead with endocrinologists, I went to everyone in the state. I found a radiologist. Now, normally those people mostly work with people who have cancer. And I was lucky to get an appointment. That's what I'm saying. And he said to me, listen, the things you are telling me, I've heard them many times before. Here's the thing. Endocrinology is still stuck in the 1970s. Gynecology in the 1870s, right? Now imagine endocrinological gynecology. Where the fuck is that? That's nowhere. Most people working there are not very good, is my opinion, but yeah. But like you said, your friend decided to seek help. I was at a point where I told myself, if I need help, I'm not gonna try and get it, because I've made so many experiences being humiliated, mocked, taunted, sent away, hurt. I have a lot of medical trauma that I figured, you know what? If something happens before surgery, guess I'll die. Bye, guys. You know.
I mean that sounds pretty bleak, but I have to say from experience, you know, like as a trans guy, even though I live in Barcelona, which is a really like accepting place, like it's a good place to be transgender in. And I have access to private medical care because I have medical insurance that I'm obliged, like I have to get private medical insurance in order for my visa to be approved. So I actually have access to like top-notch hospitals in Barcelona. And even in this situation, you know, and I have a career in medical professions, and I'm not afraid of this stuff. I know how to talk to doctors. I feel confident in the hospital. I understand everything they tell me. I think I have a position of relative privilege to a lot of other trans individuals when I apply to get healthcare, you know, and I pass, and I'm white, and I'm and all the rest of it. And still, I'm not in any rush to go to a gynecologist when I need to. You know what I mean? Just and it's not
That's exactly why I wanted the hysterectomy, the complete one.
It's not about dysphoria. Like, I don't really have bottom dysphoria.
For me, it's both. It's once a case of dysphoria and then medical trauma. And when that comes together, I mean, it plays off one another.
Yeah, that sounds like a lot of fun. It really does. It might be interesting to talk about like bottom dysphoria for a moment, if you want to.
Sure.
You know, because I kind of like feel like a lot of people ask me, so what does non-binary mean to you, right? Because I started my YouTube career. I started my way on this website talking about how I was a non-binary individual, basically going on testosterone. And in the beginning, nobody seemed to like even ask me what does that mean to me. And nobody seemed to doubt that I was non-binary, except for like, you know, the scum that tell you you're not non-binary because it doesn't exist. So people who were okay with non-binary completely accepted me being non-binary, right? And now that I'm further along in my transition, everybody seems to assume that I'm a binary trans guy, right? And this has to do with optics, I think, more than anything, because I was visibly very androgynous for a very long time, and I was very comfortable with an androgynous presentation, and I played off it. You know, I would wear like feminine stuff and then masculine stuff. I think I even have a video in a dress with like everything like out there, and that's just not my style anymore. I mean, that's not. I now feel comfortable with a more like masculine presentation, and I've been getting responses like people are like, "You're not non-binary," which I think kind of speaks to how people perceive non-binary basically as an aesthetic. You know, and it's like really made me think about, okay, what does non-binary mean to me, and why do I cling to this label? Like what is that about? And the best thing that I've come up with is that, to me, it kind of ridiculously enough comes down to genitals. Because when I think about binary trans, a big part of it has to do with looking and functioning like a cis male, you know? And seeing as that part of cis masculinity, like having a penis, penetrating, peeing standing up, getting erections, all that stuff, is like, it does not feel to me as something I was supposed to have, you know? Like when I look at my chest in the mirror, I go like, I mean, it doesn't feel mine. You know what I mean? Like I look at the mirror and I'm like, I see the breasts and I'm like, I know my chest is beneath them, in a sense.
Yeah.
At least that's like my thoughts process. You know, I feel like I can't see myself, like I'm somehow hidden until I have top surgery. And although it took me a very long time to decide to have top surgery, now that I've decided on it, I kind of like wake up with a song in my heart in the morning. You know, I'm like, I'm so relieved that this is going to happen. And on the contrary, when I contemplate bottom surgery, even if it's just metoidoplasty or like the less invasive things, I think like there is an aspect to it that could be interesting, but I don't feel the compulsion to kind of think about it all the time the way I do with the top surgery. Now, some people have talked to me about like shifting dysphoria, like as long as you can see your breast, that it's really focused on it. And that the bottom dysphoria is something that will come up for you later. But to be perfectly honest, I wouldn't want to give like the functional aspect of my reproductive system up. Like I wouldn't want to live without like the ability to have intimate relations the way I do now. And I think that someone who's very binary in their perceptions, and I could be wrong here, but I feel that someone who's very binary in their perception wouldn't really feel as connected to that experience as I am. Like I feel like it's innately an experience that is of my body. Like it's not about do I like it or do I not like it, because you can have a relationship with your body that's not exactly 100% positive, but is it yours or not? You know what I mean? And I do feel like it's mine.
Yeah, makes sense.
And then you're kind of left with like this image of yourself where you feel like, okay, I should have a masculine appearance, but I also know that I have a female reproductive system, and that doesn't match for a lot of people. And I have to admit that I do feel like that's something that's not really accepted in society. I myself still think of myself, as a freak sometimes, and I need to like work that through, and I need to see like, okay, how can I be okay with this thing that I am? But it does genuinely feel like all of these parts belong to me.
Yeah. And I can tell you, I thought some years ago, maybe, this is the difference between being non-binary, being binary trans. But I can tell you, after joining so many groups and meeting so many trans people, most trans men are not even interested in bottom surgery, it seems. And I'm talking about genital surgery and not reproductive.
Mm-hmm.
I think at the end of the day, the statement, I would like to have this set of genitalia naturally, so be born with it, or I would like to have a set of genitalia and I'm going to have surgery and see where that gets me, are two different things.
Yeah.
If we consider how invasive and how difficult those bottom surgeries are.
Yeah.
You mentioned something. I believe in English it's pronounced meta-idioplasty, and that means that's a clitoral release.
Yeah.
And a clitoral lengthening depending on who does it.
Yeah.
So with that, you have a lengthening where they reroute your urethra into the tip of your, what they call clitoris penoid, because they make a little penis out of, it's super embarrassing essentially, but yeah. So that's option. It really depends on what surgeon you go to. That's one option. That's cool. For most people, it won't be big enough to penetrate with. And for most people, they won't necessarily be able to pee standing up with it.
Yeah.
It depends on your anatomy. And then some doctors do like a suction around the area so that stands out a little bit more. It's optional. The other big thing, of course, is phalloplasty, which is when they take donor tissue from your thigh, from your arm, from your back, from your belly. Depends on the region really where you live. Different people have different techniques there, and they create a penoid, so a penis-like organ. And then you get the option a couple of months after that surgery, if the transplant healed properly, whether you would like to have a rod or a pump, an implant inserted, and that needs to be replaced every couple of years so that you can have erections and penetrative sex and whatnot. The third thing, and this is something that mostly happens in conjunction with either of these two procedures, most people don't do it as a standalone procedure, is the aforementioned vaginectomy or colpectomy, when they close the vaginal opening. But think about what kind of tissue that is. You can't just sew your mouth shut and not get sick. You get bacteria, you get really sick, you would die. So the membranes in your vagina are the same that they are in your mouth. So you need to do something about that. And what they do is they either cut that out of the sleeve, like you said, it's a muscular sleeve, or they burn them out. And then they sew the vaginal opening shut. And then in theory, you should have a flat taint like a man would have between his testicles and his anus.
I think
like
it's called the perineum, the part between the base of basically what would be a penis or testicles, and the anus is called the perineum.
Exactly.
So, yeah. So like you said, the quality of these surgeries is definitely not where their male to female parallels are. Yeah. Like the functionality.
And that's why I said it's a difference whether you say I want to have a penis, or I want to have the surgery, or I want to have it through this surgery.
And I think for a lot of people, like, I don't want to disrespect anybody who has bottom dysphoria or has an interest in these surgeries. I don't want to discourage, and I'm not judging. It's like anybody should get whatever medical procedure they feel necessary in order to be themselves, or for any other reason. I mean, fuck it. People get plastic surgery all the time without a good reason. So do whatever the fuck you want with your own body, So I just want to point out that for a lot of us, functionality is a big thing. Like if you could have something that looks like a cisgender male penis, and I've seen some bottom surgeries that are actually quite in the aesthetic respects quite respectable, you know.
Yeah.
And in terms of size and in terms of scarring, there's really like normal looking male reproductive system out there, results, I mean. But when it comes to functionality, I've heard a lot of guys talking about complications, whether it's in the urinary tract or anything that has to do with sensation. And I'm not trying to fearmonger, like some people have the surgery and they don't have complications and they have full sensation, they're able to orgasm, are able to penetrate and all the rest of it. But I have not yet heard a personal account of such story.
I've heard many of them, and almost everyone has complications in Germany and in the US. I don't know outside of that. I also know 2 people who had phalloplasty in the UK, in England, to be specific.
Yeah.
I'm with you on that. I think they are massive surgeries, very invasive, very painful, potential for a lot of complications. I respect everyone who says, I'll commit to that. Like we are committing to top surgery, for example. I know some people are terrified of that as well. But I always knew in my heart, no matter how high the risk would be, and it ended up not being high risk because I found a really good surgeon, but I'm going to commit to it. I'm going to do it. And no matter what the result is going to be like, no matter what the complications are going to be like, I'll take it. And I'm not at that point for bottom surgery. Regarding the genitals, of course, the reproductive system internally, I committed to that, yeah.
I think you make a very good point, because I did hear it from people who are like not ready to have top surgery, that they tell me like, I don't want to take time off of training, or I don't know that I want to have the scars, or what if I regret the stuff? And it's all very valid concerns, you know, and you definitely shouldn't have surgery if this is where you're at. I just want to comment that for me, this was a part of the process. Like back when I was thinking about top surgery, when I wasn't ready to book it, I was thinking like, oh shit, you know, the scars, they're so massive, because I was going to have double mastectomy. And I will have to take an awful amount of time off of training, 2 months in my case. And now that I really sit down and think of it, it was about fear of regret, you know, for me personally. And when you're talking about bottom surgery, the massive life change that actually implies, like you said, you need to be in a place where you need this so much that you are willing to assume the possibility of complication that is quite likely. You are willing to assume the results that are less than perfect, that you are willing to assume whatever it is that might be the repercussion of the surgery, because for you, it's almost like there's no choice. You know, and I'm framing it as though a choice is not a legitimate thing to take, but that's completely not the case. Like some people choose to have surgery, they could have gone without surgery, but they choose to have it, and that's absolutely cool. I'm just saying, like, the way bottom surgery is today, I think if you can be happy without it, then I personally would choose that, you know? Because...
And there's also another way of dealing with this. You could get a prosthetic, for example. Yeah. If you want to see, is that something that I like walking around with? Does this really make me feel as good looking into the mirror as I thought it would? What does it feel like to sit down with it, be active with it? Do I like even standing up to pee, or do I prefer to sit? Things like that. And those are things that you can either buy commercially made, or you can have that made custom. No, I mean, custom made in a medical context, because that exists as well.
So I actually get very dysphoric when I have a packer.
Really?
Yeah, like when I have a packer in my pants, I feel, first of all, I personally feel ridiculous because I feel like it could fall out. But no, I genuinely feel like I'm pretending, you know, which is something I've never really felt like putting on male clothes or something like that. I've never felt I was pretending, you know, And I think like for me, it's about dysphoria and that I don't really have bottom dysphoria, that when I use like a prosthetic in the sense of like when I use it in bed because I like using toys, or when I use it like to pack or stand to pee or whatever, is like as long as me and everyone who is involved in the interaction, if there's other people involved in it, are aware that this is a piece of plastic that I'm using for a particular purpose, then I'm personally fine. But as soon as somebody treats it as part of my body, I feel extremely dysphoric because it's not for me, you know? And I think for people who actually have bottom dysphoria, it feels the way a prosthetic feels to someone who has a limb removed.
I can confirm this. I don't have bottom dysphoria that's as bad as it was for the top, but it's there, definitely. And I didn't buy a packer back then. I actually bought an STP packer, so one that I could pee with. And that's called STP, stand to pee. And it felt great. And not just the peeing aspect of it, which was something I always wanted to do.
Yeah.
It feels great to pack for me in any context. So that's that. Yeah, it's interesting to see how different people are, you know, and that's not a discussion binary versus non-binary. A lot of binary trans guys would share your view on this, and it would never occur to them to call themselves non-binary. So
yeah, I think like this binary non-binary classification is a little fucking made up, you know?
Yeah.
Like I think there is quite the selection of people holding any kind of idea with any kind of definition. Like some people like, okay, I wanna give the example of a very butch lesbian woman that I know in my personal life right now. And we really talk about this stuff a lot because before she met me, she hadn't really known transgender men. And I'm talking about this woman. She's considerably more masculine than I am. Like literally, first of all, she could beat me up. She has a lot more masculine taste in clothes, you know, like she carries herself and she acts in a way that is just, I look like a faggoty little fairy next to her. And she's like the real thing. She's a fucking Chuck Norris. And first of all, I really respect that because I know how much shit that provokes in people's reactions towards you. Like my masculinity as a woman really provoked a lot of adverse responses in people. And I can only imagine what it must feel like when your authentic self is Chuck Norris and you look like a fairy forest, because she's also a very, like the body that she has is also very feminine. So I really respect what it means to carry yourself like that in a world that treats you according to what they think that you are. And when she realized that I was transgender, we had a lot of conversations about like the surgery that I'm planning to have. And she said that in a very real sense, she would have been glad to have top surgery herself. You know, she says like, I'm not comfortable with my breasts. I'm not. Oi, Niki, where'd you go? You back? Can you hear me?
Yeah.
Okay.
I'm here.
Just to recap. So I'm talking to this woman about like top surgery, and she said like she would have been very happy to have top surgery, but she doesn't want the scars. Which when I heard it, it was really hard for me to not start thinking about her as a baby trans, you know? But then we had another conversations about it, and I just asked her like, how do you define yourself? Do you think that you're a trans guy? And she's like, no, I'm a woman. I'm a woman, you know?
This topic is still relatively new, of especially butch lesbians saying they feel dysphoria about their chest and they would like top surgery. That's causing quite an uproar.
Yeah. And
people
you know
get
what?
super offended.
I think it's in a sense a lot more difficult and a lot more brave to get top surgery and still present and identify as a butch woman. I mean, butch woman is kind of like a very discriminated against identity anyway. Like it's not fun. It's not, nobody chooses this. Like nobody does this because it's cool. Okay.
Yeah.
It's not trendy. It's not cool. Nobody likes butch women except, you know, the people who fall in love with them. And they're not given a lot of passes in the world. And I think, okay, for a butch woman to say, I want to remove my breasts and still be considered a woman, that actually challenges gender and challenges even the notion of transitioning, you know?
Yeah, definitely.
And I think, yeah, and I think because it really challenges all these things that people have a gut reaction of negating. Like, no, you can't have top surgery and still be a woman. Because if you have top surgery and you're still a woman, then me having top surgery doesn't make me a man.
Exactly. And I feel I can weigh in on that because I was, I mean, okay, it feels dumb to say no, I was a masculine woman because I never saw myself as a woman.
Yeah.
But I wasn't able to transition until I was 26 or something.
Yeah.
So that's how the world saw me. Being a masculine woman, being read as a masculine woman, difficult. I know it's not easy for feminine guys either, but I can only speak of my experience. And sure, I identified as a lesbian. That was the only thing nice about my life, really, even though I never saw myself as a woman. People told me, no, you are a girl since I was a little kid. So yeah, I call myself a lesbian, whatever. And really, women were the only nice thing about that. I didn't call myself butch, but I was being read as it. And at the end of the day, that's also US-centric terminology, you know?
Yeah.
Like it wasn't relative to where I grew up, is what I'm saying. Yeah. And if I weren't trans, I would have probably gotten top surgery too. I mean, I was secure enough in my identity. The legal nightmare aside of trying to get top surgery without a trans diagnosis, but being a masculine woman is hard. I did it very well. I had to do it. It was, yeah, as far as I could go for the longest time. I get that people are confused about it when someone tells you, no, I'm a woman. I identify as female, but I'm dysphoric about this.
Yeah.
More power to them. Let them.
I think that they really give like binary people, cis or trans, I think they really give binary people a headache, you know?
An identity crisis.
Yeah, because they're trying to compute something that just doesn't fit into the scheme. You know, the more I advance on this journey, I really get the feeling that you have an innate sense of who you are and where you fall on the range between male and female. And you have a distinct but equally innate sense of what your body is supposed to be like. You know, and these things are kind of separate. For me, at least.
Totally.
So for me, like being a guy is not important. Like I understand that the way I present and the way I speak and the way I behave and the way I interact with the world is mostly seen as masculine. That's fine. You know, it's just that's the way society interprets the things that I do. And I'm comfortable with society treating me that way because they treat me positively. You know, before they treated me positively for caring, for emotional support, for things that were supposed to be feminine conduct. And now I'm getting positive feedback for things that were supposed to be masculine conduct. And I like not being treated as a freak because that's a very nice place to be in, especially when you pass and you haven't passed. Like I basically didn't pass perfectly since I was a child because when I lived as a woman, I didn't pass very well as a woman. So this is actually the first time in my life that I pass, and that's a very good feeling. But it's not a goal for me. And I hear about a lot of people who would really set that as a goal for themselves because the social sanctions for not passing are so like rigorous. So for example, that same woman that I was talking to, she told me like, I don't think of myself as transgender, but if I were to transition, I would get bottom surgery as well. And I'm like, why? And she said, because I wouldn't want to explain to the girls that I get with why I don't have a dick.
Those are very good points you're making. And I would like to say something about both of them. First of all, if we tell someone, no, I'm a woman, I want top surgery. No, you're not a woman. You have to be trans. You just don't know it yet. I know it better for you. Then we're also telling all those people, most of them are binary, all those trans guys, if you don't have bottom surgery, you're not a man. And like I said, most trans guys do not want bottom surgery. I'm not saying they can't get it. They could and they don't want. So that's bullshit. And then that's a very heavy subject that not passing is sanctioned heavily. And of course, we can talk about this in a trans context. I'm trans, but the world doesn't see me as what I want to be seen as yet. We could also talk about it in the context of feminine men, masculine women, androgynous men, androgynous women, who, like you just said, wouldn't even pass as their birth sex if they wanted to.
This is
So
getting
passing
worse.
is not a trans issue.
This is getting worse because now, like, some of the backwards people have caught on to the fact that some people are transgender, but they don't know what transgender look like. So whoever is a little gender deviant, they kind of like, oh, you're transgender, you know, and they punish that very rigorously, like the butch women getting thrown out of, I say butch, but I mean like masculine presenting women being yelled at women's bathroom is something that I've had to deal with since I was 15. But now that some women are aware of the fact that transgender women exist, this is actually a lot worse.
Yeah, sure.
You know, and it usually comes out on really like just cis women who don't pass as cis women, which drives me crazy because like y'all are eating one another, you know, like what is wrong with the cis? I know exactly what's wrong with them. I never had to think about it. But like not passing as your gender is something that I've seen cis women who deal with it. And I used to have this friend in university who looked like a lesbian. I mean, when I say lesbian, the word like creates an image of a stereotype, and she looked like that. And I mean, this poor girl, she was a drummer, she had a mohawk, she was muscular, she dressed like a guy, and she was a heterosexual girl.
Yeah. Oh, that's really difficult. Yeah.
Yeah, and she told me like this thing, she told me, I had traveled to Africa for like a drumming thing, right? So she traveled to Africa and she said, when I was in Africa, I was just a white girl. And it was like, to her, it was heaven. Because
sure. I know what you mean.
Yeah, she was just like getting catcalled on the street. And she was, this is wonderful, you know? Which is kind of like dumpster diving for reassurance, the way like ContraPoints once, I think, coined the term. But I get it, you know, it's like the way we do toxic masculinity just to get approved.
Yeah.
It's like, Jesus. Oh shit! I have to kind of finish here because I have to go work. So any like concluding statements?
We're gonna try and talk about testosterone application levels next time when we have time for that.
Yes, because we always
we talk about that again.
Yeah, we always set out with like a huge list of things, and then we like end up talking about one thing just profoundly. So
that's okay. You know, the topics are so rich. There's so much to be said about it, and not just from our own experiences. Also, we speak of people we've met along the way.
Yeah,
I think it's natural that we stray there a little bit, but it's interesting. It's useful information for a lot of people.
I think it is, because I don't think there's currently like a podcast out there about two trans guys talking about masculine trans issues. So
me neither. I think so.
We might not be the best, but we certainly are one of the firsts. So
we need subtitles. What is this shit? Speak English, guys.
Okay, if anybody wants to subtitle this conversation,
good luck.
That would be like a really good fan contribution. I don't think we have fans. Not yet. Yeah. Okay.
After you get top surgery, take off
After
your
I get
shirt again, we'll have fans.
Yeah, I sometimes entertain the fantasy of doing a very elaborate top surgery montage video. And I'm like, who the fuck are you kidding? You're not gonna do that. You know? But it would be cool. I even have like a couple of songs picked out for it. Very dramatic, all of them.
I did my top surgery reveal on Instagram with music. That was dramatic.
I'm gonna go see it now. Okay, Niki, thank you so much, and thank you to everybody that's been with us through this 75 minutes conversation. Respectable. Okay, ending it here. Love everybody. Love you, Niki, and the cat says hi too.
Thanks, man. Take care.